been a long time since I was in medical school, but I still have a very clear recollection of what it was like. Medical school can be a very challenging time. A lot of content, it's a lot of information, a lot of long hours, not that much sleep, appreciation. It does take a lot out of you. I still look back at it with fondness though, but residency is even worse, so there's that.
Life of a medical student summed up in 10 seconds.
So how's your day, man? Don't start with that horseshit, dude. You know exactly how my day's been. I just left the lab and I was jealous of the cadavers. I'm starving and all that ramen noodles. I'm in debt $300,000, dude, and I haven't slept in 2 days. You tell me, how the is my day? How the is my day? It's not better than yesterday.
Yeah, as I already mentioned, medical school can be tough, especially if you are not exactly used to the amount of work in your undergraduate or whatever you did prior to medical school. And that's not to say that other programs aren't hard, but medical school is on another level when it comes to the amount of content that you have to consume on a regular basis and, you know, be up to date and with all of that information. Of course, this is occurring at the same time as you are amassing an exorbitant amount of debt. It takes a lot of money to pay for medical school and to pay for the equipment, the textbooks, and everything else that is required. You are not getting paid during that time. So that can also be quite stressful, in addition to all of the information that you have to learn. So, and every single day is like that. So
better than yesterday.
You really can't get down on yourself. The next day is just gonna be the same. And if you get behind, then you're 2 days behind. Although medicine is a very rewarding career, you really have to think about it prior to entering into medicine to make sure that you, number one, are able to cope with that amount of stress, but number two, that you're actually down to have that amount of stress in your life, because that's not for everybody. Some people are much more laid back and they want to have a relaxing life. And certainly once you're out, it can be that, depending on what subspecialty or specialty you choose. But certainly going through medical school, yeah, that's not really relaxing. I don't have fond recollections of studying for the MCAT. If I were to do it again, it would really be a disconcerting and uncomfortable situation. The MCAT exam itself was a long and onerous exam. So you see here, they're looking at how long it should be and you know what they think is a good length. Any exam that takes all day long is that's a handful for sure. And when I took it, I don't remember exactly how long it was. I think it was 6 hours, so 2 3-hour sessions with a lunch break in the middle. A daunting experience to do that exam. The most important thing that's riding on it is whether you are going to be accepted to medical school. So it's long, it's hard, and I wouldn't want to do it again. Fortunately, I did well enough at it the first time that I didn't have to do that. And I feel really bad for the people that have to take it over. Yeah, so you pretty much have to be bulletproof to go through medical training because you are taking shots from so many different directions. It's funny because when you get into medical school, they always tell you that you're the brightest of the bright. But now you've collected all the bright people together. And most of the people who come to medical school, they're used to getting high marks already. You might not necessarily be the brightest of the bright anymore because you are amongst all of the brightest of the bright, and somebody's going to be the smartest, and somebody, you know, there's someone's going to be the smartest, there have to be other people that are not. You're not always the one that's going to be at the top of the class. So it's hard to take that and to not necessarily have the same academic performance to which you were accustomed prior to getting into medicine. And then of course, there's just all of the material that you have to go through and learn and understand. The financial implications of study, which I've talked about. And then you go to residency when you finally select the field that you want to go into. And during residency, it's an educational experience and you are getting paid, but it's kind of like paid slavery, because the amount that you're getting paid and the hours that you work are not really commensurate with one another. So you are really underpaid for what you do and the time that you put in. But that's just the name of the game. That's the way it is, and we've all gone through it. You are taking shots from a lot of different directions, and if you are not bulletproof or you don't have your body armor on as you go through, then you might be left on the battlefield, unfortunately. So always wear your bulletproof vest, always.
To crush the MCAT or any standardized test, keep watching.
Create a list of all possible study resources and type.
Oh baby, look at that satisfying auto highlight.
I'm sure that this system, it sounds like it's very organized and it sounds like it would work, but holy man, like this dude is putting more effort into this than I would put into studying, just on making this system to prepare for studying. Wow, like this appears more complex than the material that I'm planning to study. So I'm not sure about this. It probably worked for him, and maybe it would work, but wow.
I had an overview sheet.
That's a lot of work, man. That's a lot of work. Obviously, this dude is an Excel, master, Excel wizard. Yeah, that's not me. So, whoa, boy, nice work. But yeah, I'm just gonna do it the old school way. Venn diagrams and flashcards and read the material. Works for me. We're always playing these games with students as you go through. This was the way it was when I went through, that staff people are quizzing you all the time. And it's funny because, they're teaching us how to do medicine, but a lot of these people don't have any formal education training. They teach you and they quiz you in the way that they think works best.
Look, I'm a doctor, not an escalator. Spot, give me a hand.
For some, that just means peppering you with questions all the time to see if you've read the material. That doesn't necessarily mean that you comprehend or you understand the material, even though you might have memorized it. And as soon as somebody asks you a question, you're trying to figure out in your head, what exactly is this person asking? Because you might know the answer, the textbook answer to the question, but they might not be asking that. Even though it sounds like that's what they're asking, they might not be asking that. You're always kind of hesitant with your answers that you give back to the staff person. A lot of time you want to keep it really simple. You never really want to open a door that you cannot walk through to the other side. The preceptors will be happy or go through that door with you and let you hang yourself with the mistake that you've made. And when you're just with the staff person by yourself, it's really uncomfortable. But when you are in a group, when you're doing group rounds, or when you're there with your peers or with residence fellows or anybody else, yeah, it's really embarrassing. we have this vision in our heads of what it is that we get to do when we go through medical school, and what it's going to be like when we become physicians, and how we're going to interact with our patients. And there are moments when we are doing that type of thing. However, when you're in the emergency department or on the ward, and where you actually have people who are sick, ill, injured, or they're under the influence of alcohol, drugs, medication, whatever, yeah, sometimes there is some craziness that goes on. You kind of have to learn to ignore that. If you don't, you're not going to be able to do the job that you're supposed to be doing. So if there's any other TikToks that you want me to react to, be sure to let me know. As always, that's been a word from Dr. Chris, not your everyday ortho.